Hi, this is Dr. Simon-Cereijido, and here we have our third video on risk factors for early communication disorders. Let's keep on talking about biological risk factors. We have discussed before age of the mother, we have discussed poor prenatal nutrition, commonly used teratogens, those were alcohol, tobacco, caffeine. We have talked about illegal drugs used by the mom. Now we are going to talk about pregnancy and birth complications. Diverse pregnancy and birth complications such as anoxia, prematurity, toxemia, and low birth weight have been found to be associated with a wide range of childhood problems. Associations include general developmental delays, speech and language problems, and school difficulties, among others. Anoxia results when oxygen is not being delivered to a part of the body. If the condition doesn't involve total oxygen deprivation, it is often called hypoxia, although the two terms have been used interchangeably. A related condition, anoxemia, occurs when the blood circulates but contains a below normal amount of oxygen. Toxemia is the presence of bacterial toxins in the bloodstream. It is also called blood poisoning. Toxemia of pregnancy is a condition encountered in pregnancy characterized by high blood pressure, proteinuria, and edema. Proteinuria is abnormal quantities of protein in the urine, which may indicate damage to the kidneys. Edema refers to swelling. Toxemia of pregnancy may precede the onset of seizures, and it is also called preeclampsia. A baby is preterm when it had less than 37 weeks gestation, and it is called postterm when it had a gestation greater than 42 weeks. Remember, in the previous video we talked about the extremes of the normal distribution in biology, right? So preterm is dangerous, postterm is dangerous too. Birth weight, here you have the numbers. So let's talk a little bit about prematurity. Prematurity is a term for the broad category of neonates, of newborns born at less than 37 weeks gestation. Preterm birth is the leading cause of neonatal mortality and the most common reason for before birth hospitalizations. A postterm birth, often after more than 42 weeks, may also be problematic, like we said. Now, low birth weight is a term used to describe babies who are born weighing less than 5 pounds 8 ounces, that is less than 2,500 grams. So here we have low birth weight. In contrast, the average newborn weighs about 8 pounds. Over 8% of all newborn babies in the United States have low birth weight. On the slide, you can read the cutoff scores for very low birth weight here and for extremely low birth weight. Okay. And if you combine weight with gestation, you will get the size for the gestational age. And so we are going to look at the different percentiles. And we can have a small size for gestational age, appropriate, or large. You will understand more in the next slide. So here you have it. Here we have the normal range for typical babies, and the green line represents the 10th percentile for relating gestational age with weight, and here we have too large, right, the 90th percentile. So so in this is the area where we have appropriate size for gestational age, and of course it increases with a month of gestation. I would recommend you to keep these slides because and this information, because this will be useful in the future. Okay, another biological risk factor is the role of genetic factors. Genetic factors have been shown to be significant contributors to a range of developmental disorders, including autism and special language impairment. Researchers have been investigating specific genes in families with communication disorders. The gene FOXP2, a gene that decodes a transcription factor expressed in the brain that affects brain development, was identified in the KE family, who suffered language and speech motor disorders. Studies of families with dyslexia, difficulties with reading, have focused on other genes, such as ROBO1, a gene that codes for a protein that plays a role in neuronal axon growth. There are two other genes, the KIAA0319 and the DCDC2, that were also studied in dyslexics. These gene products disrupt neuronal migration. You don't need to memorize the names of the genes, but I just want you to be aware that geneticists are looking at different genes in populations with speech and language problems. Genetics may interact with environmental and other biological factors. The significant role of genetic contributions to childhood disorders makes it necessary to assess family history of communication disorders when conducting interviews with parents of children seen in the clinic. So we always ask this question when we conduct our parent interviews, whether there was a significant family history of similar disorders. Another infection that may affect language development is otitis media or middle ear infection. The infection may also be present with fluid, a discharge, or effusion in one or both ears. Otitis media may result in temporary hearing loss. Children ages 12 to 18 months with otitis media with effusion, accompanied by mild hearing loss, were at 33% risk for developing delayed speech and language by 3 years of age in a study by Schreiber and others in the year 2000. Okay, so now here we stop with the presentation about biological risk factors, and in the next one we will discuss environmental risk factors. Once again, take notes, and thanks so much.